Good day, everyone, and welcome to another exciting Podinar from the Podinar series of the Global Summit Institute. My name is Dr. Sonia Bordin Aykroyd. I am a dentist, qualified in Brazil and postgraduate in the UK. I currently live in the US, where I founded 2 international dental training academies. For some housekeeping today, I will be hosting this session, and I would like to remind everyone that you can get CE credits from this session, and you just waited to the end of the presentation, and you can register on the link between that's posted on the Global Summit Institute page. Also, this recording will be available automatically at the end of the presentation, free to watch, along with all the Podinars previously recorded by the Global Summit Institute on their Facebook page. And I strongly encourage everybody to have a look at that page and all those recordings, as we have an amazing, rich library of Podinars with all kinds of topics given by experts from all over the world. So that's the housekeeping, and reminding you again, you can get your C credit by registering at the end of the Podinar on the link given to you below. I am very, very excited today to welcome Dr. Carlo Luis Santos, who will be talking about the topic oral care and COVID-19. Dr. Carlo Luis Santos is a Filipino dentist whose dream is to empower general practitioners with new knowledge and skills. With that in mind, he founded the Center for Innovative Dental Studies, an oral surgery workshop study group where he shares his knowledge with colleagues and helps to treat homeless patients at the same time. A very noble thing to do. Congratulations, Dr. Carlos.
Thank you.
Dr. Carlos was graduated from Centro Escolar University. He is current president of the International Dental Implant Association, Philippine branch. He is the program director and lecturer of the Center for Innovative Dental Studies, and also runs 2 dental practices in Makati City. Dr. Carlos also runs international webinars and has lectured both in Asia and US on the topics in oral surgery and periodontics. He's a general practitioner interested in oral surgery who always loved teaching. Before opening his own training center, he taught oral surgery and oral pathology to undergraduate students. Very nice curriculum, Dr. Carlo. Tell me a bit more about your work at the Center for Innovative Dental Studies.
Again, thank you, Dr. Sonia, for that introduction. So, the Center for Innovative Dental Studies, it's a oral surgery workshop / study group wherein we invite colleagues, general practitioners, because oral surgery is a subject wherein we study it in our undergrad years, but we are if not afraid, we don't know how to execute a lot of the procedures in oral surgery. So here we share to our colleagues techniques and innovations in oral surgery. So what we do, especially during the pre-COVID time, we aggressively invite less fortunate people, patients like or that has oral tumors, oral pathologies, perioplastic surgeries also. We also do like the normal wisdom tooth removal, no? And we all do this for free. We get the participants get to learn, and of course we get to help the less fortunate in doing so.
So you work, looking at your curriculum, I don't know if I got this right. You work with underprivileged patients, not just homeless. You work
Not
with.
just on. Yes.
Oh, okay,
Yes.
so that was probably the translation. So it's good to get it right.
Okay.
All right. So you, as I worked in Brazil for many years with Turma do Bem, which is a project that helps underprivileged people, and that's such a rewarding thing to do.
Yes, yes. So
Yeah.
it feels it feels really great, you know. So sometimes they would insist on paying us, but they'd pay us in fruit, in vegetable, because you know most of them you know are farmers, you know, those really less fortunate individuals. So.
And I think that the reward is actually for us, because everything that you give, you get back from.
Well, hopefully, I just pray that we're all safe. That's all.
You
That's
get
the only.
back, yeah, in a different way. So I think it's life should be like that.
Yes.
We should be helping those that cannot. So the other thing I wonder, how do you do the recruiting of these patients? Because I mean, how do you advertise that? In my project, for instance, we used to go to schools and recruit them at the schools that we know, schools that were located in underprivileged areas and so on.
Yes.
So how do you do that?
Well, the recruitment.
So they know that you can give them this free care.
So how do we invite patients? Okay, well, in the pre-COVID times, we really hold dental missions. You know, like these are free dental treatments in rural communities and poor communities, where we offer free dentures, free extractions, free like fillings, just what we use as glass ionomer, the ART method, the traumatic restorative treatment for children. We do that, and in the same way we screen individuals and tell those because in the poor areas there's a lot of surgery cases. So that's the venue where we get to invite patients. But now because you know there's a pandemic, for some reason they started a word of mouth. This guy who has a big ameloblastoma invites his friend who has a huge radicular cyst. So now it's like that. So they call our office or they visit us, and we schedule them. We don't deny it, because so that's how we get patients.
Nice, very nice work. It's amazing. So yeah, we would like to talk all day about your exciting journey. I'm sure we have a lot to tell us, but I think also the listeners are so excited to hear what you're going to bring us today.
Yes.
So let's welcome Dr. Carlos. Dr. Carlos, now you can share your screen and start your presentation. The floor is yours.
Thank you, Dr. Sonia. So, let me, okay. Can you see my screen, Dr. Sonia?
Absolutely, fantastic.
All right, so thank you for that introduction. Again, I'm Dr. Carlo Santos. I'm from the Philippines. So I want to welcome everyone who's watching in live today. So good morning, good afternoon, and good evening to everyone who's watching around the world. Okay, let me start. I would like to talk about tonight. It's almost 10 here in the Philippines, but we're still awake, you know. Well, I'd like to before I start, I'd like to tell everyone to keep safe. You know, the COVID is especially here in our country, it's getting out of hand, and I hope it ends soon. So with that, my topic for tonight is about oral cavity and COVID-19 connection. Okay, so I'd like to thank the Doctor World's Top 100. So everyone who was able to be nominated and who's new here, congratulations. Thank you, Dr. Kianer, for the opportunity, and the Academy of Oral Surgery for supporting us in this endeavor. in sharing what we know. Okay, so okay, so I'd like to talk about the importance of oral care during the pandemic. A lot of people, we are all busy in finding treatment for COVID, whether it be vaccinations or those, here in the Philippines, ivermectin is a big thing. But of course, it's as doctors, we must be evidence based. So I think I think COVID should be co-managed. In dentistry, it's undermined. So let me show you why. Okay, in this presentation of mine. Sorry. So the current situation now, okay, is like this. The patients are afraid, to go to the dentist. Why? Because, of course, the fear of transmission. Directly, we acquired the COVID virus via our oral cavity, our nasal cavity, and of course we expel, we exhale. If you're infected, you transmit also the virus via mouth. So patients now are afraid. A lot of dentists here in the Philippines, the practice have went down. A lot of patients disregard their dental appointments, dental treatments because of that type of scare. Another issue is the price, of course. Like the medicines for COVID, because of supply and demand here in the Philippines, it skyrocketed up. So even the prices of treatments, because what we do here in our practice, of course we added a fee for the COVID infection control protocol. In my practice personally, we have a saliva test that we actually it's an SOP for everyone who enters, staff, non-staff, and patients. Okay? So of course the disinfection, all those protocols, even renovating the operatory to make it negative pressure, it's step that we had to take to ensure the safety not only for us but for our patients. So the cost, of course went high. That's one of the issues that we face right now also. And of course the protocol itself, the this one, as you see here in the picture, a fully, it's like if you compare it to a soldier, full battle gear, wearing armor and everything. So this is our armor, and we need to follow this. I'm sure questions later will be how's the protocol and how's the steps that we follow in what's the right way to do it in our practice. So that's one of the problems that we face right now also. Okay, so the link between oral hygiene and the severity of COVID. We were told that once you get vaccinated, we are safe from the severe status that we can have, or the hospitalization status that that can happen to us. So we have mild, moderate, and severe. I'd like to share this. That's why I really got interested in this topic, because well, I practiced really the protocol, not so much because I know that I converted the operatories into a negative pressure room, and with that I'm safe. But I'd like just to share the story. An uncle of mine, the brother of my dad, passed away because of COVID. So this really, made me interested in knowing what we're dealing with. So this actually inspired me. So in this lecture today. So okay, to continue, So the gateway for the virus, of course, we all know that's why we get our swabs through the nasal cavity. Also we can get results for the PCR from our fluids, saliva, mucus. So with those medium we can get results when we do our PCR. But remember, the gateway of the virus is mainly the oral cavity and the nasal cavity. So that's why we wear masks. In some countries, face shields are not required, but here in the Philippines, it's required. Later, I will discuss the importance of it, and why is there a debate in where should we wear the face shield or not. Okay, so there we go. Okay, our oral cavity, lodges these three structures: our gingiva, our tongue, and our salivary glands. Okay, so here in this tree, this is very important to know. That's why we get the COVID virus because of this mechanism, this cycle. We have it's called our ACE2 receptors. Okay, so our ACE2 receptors. Okay, this is the. Let me just get my pointer. Okay. So the ACE2 receptors is this one. Okay, that's why most especially the Delta variant. It has a mutated spike protein. The spikes. This spike protein mutated in a way that it lodges quickly compared to the old one, the alpha variant. There's a lag phase. The virus would lodge there first, stay there for a while, chill for a while, but now it is absorbed fast that's why the spread is ×2. If you get the virus slow, before, not as fast as this one, it's ×2 the speed of infection. So okay, remember when we have, because of this, the ACE, we're talking about the ACE receptors. When our immune system is down, decreased, meaning where the soldiers of our body, our white blood cells, is decreased. Remember, the ACE2 receptors increases in number. Okay, they increase in number, and with that, we are more susceptible to COVID. So let's say you get a cold or a flu, but non-COVID. Let's just say for some reason you get sick, what happens is your immune system goes down and you get more susceptible to COVID because of the number of ACE2 receptors increases. Okay, so I just want to establish first the mechanism in how the COVID the virus worked in our system. So here you can see the ACE2 receptors. It's like an ice cream scoop wherein the ice cream is your COVID virus. Okay, so when the scoop gets it, it's going to put it in your cup, in the cup, or in the cone, which is your body. It will lodge in there and then replicate itself. Okay. Okay. So again, we were talking about the ACE2 receptors. Okay. So the ACE2 receptors is also found in the is also profound. A lot of it could be located in the gustatory receptors. So what is this? This is the tongue, the taste, the gland where you are able to taste. So you see there the sensory nerves. So the taste receptor. So because there's a lot of ACE2 receptors there, it lodges itself there, and there you lose your taste. That's the reason why we lose our taste. Same goes with the, sorry. Okay. So 45% in COVID patient, okay, the taste has this taste disorder. Okay, so it also affects the sensory nerves and smell receptors also. That's why we lose the smelling and the tasting. So a lot of there are friends of mine who got mild cases, or who tell me, Doc, I lost my smell, but this is, I can still taste. Actually, that's impossible. You cannot taste without smelling. So it goes hand in hand. Okay, one as dentists, one sign that your patient is may have COVID. These are that's why I believe that co-management is very important, because the dental part in the treatment, in the fight for COVID, is undermined. Here in our practice, we really urged, even in our classes, that because we're doctors, we have to know this, right? So in COVID patients, geographic tongue or COVID tongue is common. Okay, again, why? Because high numbers of ACE2 receptors are present in the tongue. So as you can see here, remember, geographic tongue is not a condition. It's the product of a condition. So because of the inflammation in the tongue, you get this geographic architecture. So that's why it's called geographic tongue. It's like the geography of a landscape. Okay. Okay. So to name a few markers or oral manifestations, COVID manifestations in the mouth. Okay, so unexplained ulcers. You get this when there's a suspected COVID infection. So as dentists, we should be able to identify this and recommend the PCR testing. Okay, so oral candidiasis. Okay, petiche. Okay. Okay, herpetiform ulcers in the mucosa. Okay, lichen planus. Sorry. Okay, the squamative gingivitis. Okay, so what do all of this have in common? Okay, so we know that the COVID virus attacks the inflammatory system, that cascade of inflammation. So all of these are inflammatory responses of our body, of the oral cavity. So this is we should play hand in hand. We should our relationship with the medical field must be sound, to be able to fight COVID-19. Okay, so what are the etiology of this? Some literature says it's a direct result of the COVID virus. Some says aphthous ulcers are from stress. Well, they're not wrong. Okay, but who's not stressed with this current situation that we have? So I think it's also related with COVID. Everyone is stressed, no? So reactivation of previous infection can also be a cause of this, the oral manifestations that I said. So why does it reactivate? Because our immune system is down. Okay. Opportunistic infection, which is always present in the mouth, of course, drug intake and meds taken, and lack of proper oral care. I forgot to add here bruxism, because of the stress that we all of us are dealing with. Bruxism, we know it's stress related, so this is very common in our dental practice nowadays. So I think it's worth observing in our patients. So one also reason for the manifestations in the mouth is vasculitis. Again, with the term itis, it means inflammation. So excess accumulation of ACE2, it causes vasoconstriction, vascular abnormalities, increased permeability, okay, leading to ulcer formation. So again, this is part of the cytokine storm that happens in a COVID patient. So I'd like to share that like my uncle passed away a few months back. Also, colleagues of ours in the may they rest in peace, here in the Philippines, who is actually vaccinated, 2 jabs already, 2 doses, got the virus, but still passed away. So we really don't know what type of variant was that, what was the playing factor, why he passed away. But so I just want to tell everyone to please, let's follow protocol. Later I'll be discussing about the Swiss cheese principle. So but there's a way to be able to be bulletproof in this virus. So later I will share to you how to do it. Okay, so to add with that, serostomia is always a factor in something that you should look upon with your patient, so for a possible COVID infection. So oral signs are important markers for COVID-19, very important. Okay, so let's talk about risk factors. So when you say risk factors, this is how quickly we get the virus, okay, complications that we get from it, and how likely will a patient die from COVID. Okay, okay, a 10-second kiss. Okay, you share 80 million bacteria to the person you kissed. So this is from Casper M. Griff, Shaping Microbiota, a journal from 2016. So I just want to I gave this an example because of the transmissibility of whether it be virus, bacteria, or or fungal, fungi. So we all know, so this is the real stuff. These are the facts, okay? So we all know that COVID-19, these are the risk factors. So the mean age is 69 years old. Okay, so I'm sure it's a fact that the people that are at stake here are the senior citizens. Okay, so 70%, statistically says it's 70% men. Okay, so the underlying comorbidities, 48% is of course hypertension, diabetes, heart disease, and obesity. Okay, so we all know that a lot of the people who succumbed to COVID had these comorbidities. Okay, so complications that you get from COVID. No? These are the reasons why people die. People die from COVID. Number one, pneumonia. Okay. Sepsis, septic shock, and ARDS. Okay, so the two actually most common cause of death is pneumonia and ARDS. So again, you do not die from COVID per se. You die from the complications that COVID gives, which is pneumonia and acute respiratory distress syndrome. So let's go into that more. Okay, so these are the major causes of death, the pneumonia and the ARDS. So acute respiratory distress syndrome, for those who are not familiar, so this is where okay, imagine your alveolus, so these are where the air sacs in the lungs are located. So this becomes very swollen that you cannot breathe. You're drowning in the pleural effusion or the fluid in your lungs, and because it's very tight, because it's all swollen up, this is the one that kills the patient. So what causes this? Okay, and I've been discussing from the start of the lecture, where does the oral cavity go in? What's the role of our as dentists? What is our role in the fight for COVID? So here you can see. Okay. Oh, sorry. Here you can see this is the normal alveolus. This is your air sacs. So this is the one that is infected. So you can see there's fluid inside. So you're drowning, literally drowning internally, and the lining of your vessels becomes swollen. So you're suffocating and drowning at the same time. Okay, and this is all because of this is all because of an infection, both bacterial and viral. Okay. So what differentiates one person from another? Why are some people asymptomatic, losing only their smell? No, what others develop serious complications, severe. Okay. So again, to recap the comorbidities: hypertension, diabetes, heart disease, obesity. Okay. So there is 52%. Where is the 52%? So we only have the 48%. So where's the 52%? Why is that most of the casualties have none of the said factors? So remember, COVID-19 is a respiratory viral disease, and some cancer patients, given their situation, does not suffer severe COVID conditions. Why? Okay. So let's answer that. Okay. So what do they have in common? This hypertension, diabetes, heart disease, and obesity. Okay. What they have? Okay, they have altered oral microbiome. All of this, when a person has hypertension, has diabetes, has heart disease, has obesity, as dentists, we know this, that their oral microbiota is altered. Okay, maybe because of the medicines they are taking, maybe in diabetes because of ketoacidosis, because of the amount of bacteria and viruses that are lodged in the gingiva. In people with heart disease, remember, a certain percentage of infective myocarditis bacteria comes from the oral cavity, and obesity. So when you're obese, all of this is present usually. Okay, so another one is bacteria. So you may be confused. We're talking about the COVID virus, but all of this, bacteria is the common denominator. Okay? So when usually when people who has hypertension, diabetes, heart disease, and obesity, they have serostomia. May it be because it's medically induced or because of the situation of the, for example, diabetes or the hypertension, no? Or for example, a person smokes, okay, which causes heart disease. Serostomia is always present, and periodontal disease. So a while ago we discussed that serostomia is a big it's a big sign. You know, it's a factor in diagnosing. It's a helpful factor in diagnosing COVID in patients. So we can say that part of the comorbidities is oral microbiome and bacteria. So it's not only hypertension, diabetes, heart disease, obesity. Oral microbiome and bacteria is also part of this, of the risk factors. That this part is very undermined. I mean, in the news, in literatures, they don't actually add this in the comorbidities, but I'll explain to you why this is very important. Okay, so bacterial superinfection. So it's very common in any viral infection because the body is so busy fighting the virus off. You know, any bacterial infection present, you know, they tend to thrive because the immune system is it's not everything is focused on that viral infection. So less than 50% COVID-19 patients die from superinfection. Oh, sorry, greater than 50%. Sorry, greater than 50% COVID-19 patients die from superinfections. So again, they don't die from the virus, but they die from superinfections. Greater than 75% admitted to the ICU requires antibiotics. So antibiotics, of course, is different from an antiviral, okay, or a vaccine. Antibiotics is for bacteria. So greater than 75% is antibiotics is required. Okay, greater than 71% admitted to the hospital were given antibiotics. So superinfection, the second infection by the same or different bacteria that is resistant to the current treatment being used. Okay? So they become they recognize the first line of defense or the antibiotic that is given to the host and becomes stronger, becomes a superinfection. So okay, to explain this, okay, so the viral infection is like it's like Al-Qaeda, okay. So our antibodies, to just give an explanation, layman's explanation, our antibodies are like the soldiers. They fight off the Al-Qaeda or the terrorists, you know. But unknowingly, there are rallies going over the government. You know, there are what they call leftists who wants to to also for their own personal gain, you know, they represent the bacteria. So the antibodies or the soldiers keep on battling the virus, you know, not unknowingly that the bacterial infection becomes so huge, you know, so it becomes hard to combat also. That's why the patient or the host deteriorates. Okay, so this is how superinfection happens. Okay, so let's talk about bacteria in COVID patients. So severe COVID patients, okay, in a normal blood work, okay, the neutrophils in severe COVID patients, you can see that there is an increased number of neutrophil count and a low lymphocyte count. Okay, this is in every severe COVID patient, this is evident. Increased neutrophil count, low lymphocyte count. In mild COVID patients, there is a low neutrophil count and a high lymphocyte count. So this is another way to determine, you know, if what type of COVID a patient has. Okay, so remember, neutrophils are bacteria fighters, okay, and lymphocytes are the viral fighters. So in severe patients, you know, we said that in severe COVID patients, there's a high amount of neutrophil. That's why I want to reiterate this, that it's like the AIDS virus. You don't die from the AIDS itself. You die from a very for a normal human being, you get a very low grade infection. A person with HIV or AIDS can die from that. So this is what happens also in it's actually the same. And the IL markers, the interleukin, are also the same with both AIDS and COVID. So I'll discuss that later. But so a higher amount of neutrophil count, so neutrophils are bacteria fighters. So lymphocytes are functionally exhausted in doing their job. Okay, and the body immune shifts is fighting the newly introduced bacteria infection. So the soldiers are all tired fighting the virus, and and when they look at their back, another enemy, and it's a big one. The infection has grown so much, the bacterial infection. That's why in pneumonia, the infection that we get, it kills the patient, kills the COVID patient. So similar to HIV, same mechanism, protein lymphocytes and okay, shifts, and HIV turns into AIDS. Okay, patients do not die from HIV and AIDS; they die because of superinfection. So these are your tuberculosis and fungal infections. Okay, so increased bacterial loading during COVID-19 infections. Neutrophil to lymphocytes ratio, best predictor of severe COVID-19 infection. So greater than 80% of severe COVID patients needs antibiotic to treat bacterial infection. And this is the antibiotic of choice, erythromycin. I'm sure a lot of you guys, this is the generic name of this antibiotic. Here in the Philippines, it's called Citromax, the brand name, but it's a very broad spectrum antibiotic, and I think it's fourth generation, if I'm not mistaken, cephalosporin. But well, let me check on my pharmacology, but I'm not sure about that. But yes, this is the antibiotic of choice in treating the infections that is caused by the COVID virus. So bacterial introduction through the mouth. Okay, so aspiration of oral pathogens into the lungs. So of course we breathe, we inhale, we exhale. Me and Dr. Sonia a while ago was talking about inhalation using the mouth and using the nose, because there are patients who are mouth breathers. We know this. So this also plays a factor, those little things, even with mouth and nose breathing plays a factor in the infection of COVID. So periodontal enzymes modify oral surface, which allows adhesion because of your status, the periodontically compromised patient. And remember, periodontitis, it's directly linked to diabetes. We know that. That's why that's one of the comorbidities. And when you have this, periodontal disease, it's an inflammatory disease which can trigger the cytokine. So and so on and so forth, cytokine storm. Okay. All right, so respiratory epithelium altered by periodontal cytokines to promote infection of respiratory pathogens. Okay, so it's just a domino effect, because of poor oral hygiene, it alters your oral cavity, which makes it which makes adhesion of viruses, bacteria in the mouth more imminent, more profound. So when you inspire, or when you breathe inhale, okay, you inhale this bacteria. Okay, so the respiratory epithelium altered by the periodontal cytokines to promote, that cascade of inflammation. So it's very simple actually. The bacteria and the viruses lodges in your oral cavity, and then you inhale it. Okay, so bacteria in the mouth. Sorry. Okay, wait. Let me just take this laser pointer out. Okay. Okay. So bacteria in the mouth enters to the lungs, which progresses to pneumonia. Okay. It's a bacterial infection, okay, the pneumonia. So diabetes, hypertension, cardiovascular disease are associated with these bacteria. And I think we are very familiar with this. The F. nucleatum, B. intermedia, P. gingivalis, all are oral bacteria. Okay. That's why I want to stress this out, that dentists play a big role, in preventing and in saving patients' lives in COVID. Okay, So continuing with what I was saying, patients with periodontal disease are at risk. Cardiovascular patients with cardiovascular disease, 25%. Diabetes, 3 times moreover, at risk. Hypertension, 20%. Obesity, three times more at risk. So periodontal disease causes systemic inflammation. Okay, remember this: interleukin 2, 6, and 10. The only interleukin that is not included here is the 24. Okay, but all of these are the same inflammatory markers that COVID has. So when you have periodontal disease, the inflammation that produces this interleukin, okay, it can cause the start of the cascade of the inflammatory the cytokine storm. So how do we stop? How do we avoid it? Of course, we play an important role, the dentists. So okay, this is almost done. Sorry. Okay, so periodontal disease increases the risk of respiratory infections. Okay, so again, starting with this lecture, I told you guys that there are two reasons why COVID patient dies. It's because of pneumonia and ARDS. Okay, so we get the infection from the mouth. Okay, so poor oral hygiene increases the risk of respiratory infections. Improved oral hygiene cut the incidence of pneumonia-related deaths. Okay, so in half actually. Sample of bronchial lavage from hospitalized pneumonia patient revealed. Okay, so bronchial lavage, they got the sample of the pleural effusion, the water in the lungs. Okay, and they found out that the bacteria present in the pleural effusion came from denture plaque and periodontal disease. So knowing this, I think we that's why I think people should notice our work. It's actually it saves lives. So your normal oral prophylaxis, your those dental appointments, those twice a year dental appointments, not unknowingly it will save the lives of possible COVID patients. So let's recap. 4 main comorbidities associated with COVID deaths are association from altered oral bacteria and periodontal disease. So periodontal disease implicated in systemic inflammation, bacteremia, and pneumonia, and death. So it's proportional. It's very related. So people with periodontal disease. So all the oral healthcare providers plays a role in this, most especially in educating the patients. So P. intermedia periodontal bacteria can induce severe pneumonia and death. So this is a oral bacteria. You can find this in the mouth. Okay? Antibiotic plays a crucial role in COVID. So oral hygiene is the key. Again, so this is the one I was telling you guys. Okay, this is a very good model on how can we prevent COVID. How can we be bulletproof against COVID? It's possible, guys. It's very possible. This is the way so that if we love our children, our loved ones, especially the new variant now, children are most of the victims are children. Here in the hospitals here, there was one medical doctor telling me that 7 out of 10 patients were children. So it really breaks my heart because I have a daughter. So I want to share this Swiss cheese model. Okay, so according to this model, so the Swiss cheese, it acts like a wall, a barrier. Okay, so here you can see on the left side. Okay, so this is the COVID virus. Okay, so it's trying to penetrate it, to reach to you. So how do we defeat it? So layer by layer we can. So one layer, contact tracing. One layer, physical distancing. Another layer, hand hygiene. Because if it's only like 2, 3, 4, 5, 6 layers, remember Swiss cheese has holes. It can penetrate. Just imagine that. Okay, but if you layer the Swiss cheese, a lot of layers in front of you. Screening and testing, another layer. Okay, cohorts, quarantine, self-isolation, and not going out, avoiding gatherings. One layer. Ventilation, air filtration, outdoor spaces. Another layer of protection. Okay, enhanced cleaning, disinfecting, reduced gathering capacity, staff training. Okay, all of this combined, I'm definite, I'm sure, I'm certain that no COVID can infect you. So statistically, there was this study also that was released that here in the Philippines, most of the cases actually came from the relatives. People, because you miss each other. Let's go. Let's have lunch. Relatives gathering, like cousins seeing each other. So personally, I miss my relatives really. I'm such an outgoing person. My friends, but I came to realize when my uncle passed away that this is very serious. Like most especially the variant that we're trying to fight now. So if we just follow the Swiss cheese model, I think we have a fighting chance with this virus. And of course, get vaccinated. So of course, we should respect the decisions of the anti-vaxxers, but I hope you guys consider to get vaccinated, okay? Because it's the only way, and it has been proven, through millennia that the vaccine really works. Okay, so as a dentist, so I'm in the last part of the lecture. So how can your dentist help? How can we help our patients? Of course, oral hygiene recommendation. Okay, toothbrush, flossing, definitely to avoid those dental signs that I discussed a while ago, and mouthwash. A study was made that hydrogen peroxide based mouthwash is really good for fighting the virus. Okay, so betadine, we know that betadine based, and another one that I was researching on is the hydrogen peroxide based. Okay, so again, oral hygiene improvement. Change your toothbrush every 3 to 4 months. Remember, what cleans your teeth is not the toothpaste, it's the brush. That flicking motion is the one that cleans the teeth. So if your brush is it's like the broom of a witch. It's like really literally like a broom. If you use it to sweep the floor, it won't be able to. It has to have that flicking action. So if patient has COVID, of course you change the toothbrush immediately. Fluoride therapy, actually, of course, fluoride coats the enamel and protecting it from from caries, which lessens the incidence of infection. Okay, so flossing, denture hygiene, very important. Okay, so we all know also that when you're cleaning, we use denture cleaners, not dentifrices or toothpaste, because toothpaste is granules. It will also it's like using sandpaper. It will thin out your denture. So denture cleaners is the best option. So toothpaste with sodium lauryl sulfate. A study was made that this actually kills COVID, the sodium lauryl sulfate. So where is this also found? If you look at your shampoos, you can find this, your soap. So, but there are the majority of the toothpaste has SLS in their ingredients. So biofilm removal, I know it's there's this new thing that it's actually the technology is old, but it's kind of very useful now, and actually I'm planning to get a unit of it, the ozone therapy. I want to say hi to Dr. Lito, who's listening right now, and Dr. Pocholo. They're my partners in the CIDS, the surgery workshop that we hold. So they're the one who are convincing me to use the ozone. It disinfects the surface or the area with using ozone therapy. So, and of course, periodontal therapy. So brushing your teeth can save you and our patients from COVID and vaccination. Okay, so with that, I'd like to thank Global Summit and the Academy of Oral Surgery, Dr. Kianer, for giving me this chance again. Once again, I missed lecturing here. So thank you everyone for listening. If you have questions, just type it down. I'll answer them yeah, later, or even but you will get an honest answer from me. So these are my contacts if you wish to email me questions, anything, um problems, just just contact me in this numbers and social media platform. So thank you once again, guys. Have a good day, good afternoon, and a good night. Okay, so Dr. Sonia.
Thank you, Dr. Carlo, for the wonderful presentation. You can stop sharing
Okay, okay,
now,
okay. Yes, wait.
and we go for some questions. So first, I've prepared a question that I would like to ask you relating to this. It was amazing, the new connections that you've been making and things
Yes.
that unfortunately are not being talked
Okay.
to. So it's very good for you to be bringing out this awareness to
Oh,
the
I'm glad
people.
I did. So yeah, thank you also, Dr. Sonia. So yeah.
Right. So my question to you is, we know now that nasal filtration of particles smaller than 5 microns is low. So
Yes.
infectious particles above that size tend to remain in the upper respiratory system. However, particles between 0.25 and 0.1 microns can travel directly to the alveoli and the lungs.
Mhm.
And particles smaller than 0.1 microns can even go directly to the bloodstream, heart,
Yes.
organs, and brain.
Mhm.
And the other thing is those particles smaller than 5 microns contain 8.8 times more microorganisms.
Yes.
And the highly transmissible COVID viruses are measured around 100 to 120 nanometers.
Mhm.
So my question to you is, in your opinion, if SARS-CoV-2 can be present in great numbers in those small particles that can travel directly to the lungs and alveoli, or in those that can go directly to the bloodstream and some organs, could there possibly be a relationship between the inhaled particle size with its respective viral load and COVID-19 symptoms or severity, or those post-COVID sequelae?
Yes. Okay, thank you for your question, Dr. Sonia. That's
Sorry,
a
it was a bit
very,
long.
yes, it's a very challenging actually question, but I like a good question, and I will answer you to the best of my ability. Okay, so well, okay, first and foremost, the variants now, I mean, mutations has been happening, like there's the Delta, and I hope with the Delta it stops there, because I heard that there's more to come. But okay, so you're asking if the amount of virus that a person inhales is a factor in the severity of
Yes.
COVID. Okay, so well, the remember I was discussing about a while ago about ACE2 receptors. So these ACE2 receptors are present all around our organs, our body. So the mucosa, the tongue, salivary gland. So okay, so to answer your question, if if your immune system is down, so let's say for some reason, and a lot of ACE2 receptors will be present. The normal number is doubled. So with that, if you're asking that one tiny speck of a virus that enters, let's say in your tonsil, in your tonsil, wherein a lot of ACE2 receptors are present. It doesn't need to enter your, the deeper parts of your the lower parts of the organs to infect you. Just according to what I read and researched, it just takes one to produce this the COVID-19 effect that we're seeing. And what will play the role in the severity is your comorbidity. So I discussed a while ago about the comorbidities about regarding COVID, your obesity, heart disease, so uh, may it be, if you're a healthy person, you're an athlete, you're like Manny Pacquiao, or you're fit, this, I think this will be ACE2 receptors will be less, way less than the normal ACE2 receptor. So susceptibility to the COVID virus, it's of course less also. And the comorbidities, like what I said, plays a big role. So having no comorbidities will of course play a factor in that slight moderate and severe COVID what do you call this, COVID infection that one might get. So there, it just takes one speck, doctor, of virus. Well, so if it's a lot, it's very dynamic also, the way you inhale it. If you were gulping a smoothie, and the amount of the suction that you aspirate in your, maybe you can gulp a lot, but like what I said, it just takes one to lodge in that ACE2 receptor, go inside your body, then do its job. So then the comorbidities will play the role in determining the severity of your COVID. So I hope I answered your question, Dr.
Yes,
Sonia.
thank you very much. So I'm going to go for a next one. You
Sure,
showed,
no problem.
thank you very much. Yes, it was a great explanation. You showed the study of Dr. Georgian et al., 2008, that reported samples of bronchial lavage from hospitalized pneumonia patients, revealing bacteria from denture, plaques, and periodontal disease.
Yes.
We now know that periodontal disease can increase the risk of respiratory infection, of course, and you mentioned that very well. You also mentioned that aspiration of oral pathogens can get into the lungs, and showed this study by the Dr. Nagaoka et al., 2020,
yes,
demonstrating that bacteria from the mouth enter the lungs, which can lead to pneumonia.
yes.
Now, nose breathing is the physiological way the body uses to filter pathogens and to kill those pathogens through the release of nitric oxide.
Yes.
Mouth breathers skip that filtration. The number of mouth breathers are increasing due to craniofacial underdevelopment and parafunctional habits in Western culture society lately, and also currently with the use of masks.
Yes.
So my question to you is, given the benefits of nose breathing and the growing evidence of the role of oral contamination and aspiration of microorganisms on COVID infection, should we be adding re-education of nose breathing to our oral hygiene recommendations that you put well for the combat of respiratory infections and COVID?
Okay. So another interesting question, actually. Well, that's a good point that you raised, Dr. Sonia, about nose breathing, because you're correct. The NO, or the nitric oxide, in nose breathers actually plays a role in filtration of any pathogen. May it be virus, may it be specks of dust. So remember, the nitric oxide, it resides in our sinuses. That's why there's this exercise that actually the ENT, they do this. The ENTs, our brothers and sisters in the medical field, to stimulate nitric oxide by humming, by just you hum, you say this M, you make this M sound, and make the palate, that area in the palate vibrate. It stimulates the sinus to produce nitric oxide. It's well, can I demonstrate it? It's like this. It's like,
yes, please.
and then you you can feel actually it resonating, you know, because
Interesting.
our sinus is a space. It's an empty space. So if you do that humming, you can feel the vibration in your here in your maxillary sinus, no. So this produces nitric oxide. You know, so this really aids in filtration and in fighting. It's like
Mhm.
it's like a what do you call this? It's like your tonsils, or it's like a checkpoint where a police check. So everything that passes, they check, and you know, the criminals, they get and then the good ones, they let it pass. So but
Like the
there's
Swiss cheese you just showed.
yes, exactly, the Swiss cheese, the Swiss cheese. So but there's a current study, Dr. Sonia. It was just published this August. You know, I'm going to share it in the comments. You know, that says that the current variant, the Delta variant, actually is, you know, the encapsulation of it, even the, because it can be swallowed. You know, a lot of, you know, the modes of a virus doesn't end in just lodging in the mucosa. It also, you know, for some reason you're slurping this cold smoothie or juice or water wherein the virus is present. You can ingest it. It goes to your gastrointestinal tract. So the study says that the virus is actually susceptible. It's not affected by the gastric acids. So it's that resilient. So having have said that, I'm sure definitely that the nitric oxide will have a hard time in combating that. But I will send. I'm not really fully familiar with the mechanism of it, but I will share the journal uh, below in the comment section, so that you guys can read it, and you know, maybe you have a different take on that study. So there, no, but definitely, Dr. Sonia, with the Swiss cheese model, you know, and nose breathing, you know, I think everyone should practice this. No, breathing in your noses when, you know, you have to run to the drugstore, get something, you know, quickly. But I said it's multifactorial. You have to practice the of course the no gathering, okay, just being at home, the protocols with this and with nose breathing. I think it would play a big factor in helping us not getting the virus, Dr. Sonia. So
Yes,
there.
fantastic.
Okay.
It's interesting because you kind of uh, raising awareness of the mouth in
Yes.
context of the swallowing or the bacteria, which or even the virus that we now know
Yes.
can lodge in the saliva,
Mhm.
salivary glands, etc., that could be infected directly penetrating via the mucosa of the mouth, correct? And
Yes.
via the
Yes.
swallowing, which they are there living in the saliva already to the inside the oral mucosa. And then we can swallow them, and that way they can also contaminate. We've been at the beginning, we kind of, the media was talking a lot about the touching of the eyes and the oral
Yes.
nasal mucosa, blah, 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 blah. But if you think about it, the oral mucosa is like, it's so exposed
It's very.
to,
It is.
and is not just exposed to the contamination itself, but is lodging,
Yes. Yes.
is
Yes.
serving as a reservoir. So again,
Mhm.
dentistry being in the front line of this.
Mm,
So what you say is that we should be not just think of the breathing, but we should also be thinking about the swallowing,
a lot. Yeah,
correct?
everything that happens in the mouth, we should actually, it plays a factor in this battle we have with COVID. So
Yeah, and
swallowing,
then
chewing, everything. So
yeah, and then later on, not even satisfied that the virus have happened to enter to that, we can give our own bacteria or flora to aggravate a
yes. Yes.
case
Definitely.
of COVID,
Mhm. Of course.
right?
Yeah. Yes.
And
Yes.
increase the death rate with
The
to
death rate.
pneumonia, blah, blah, blah. Is
Mhm.
that what
Yes.
I
Mhm.
understood? All
Yes.
right.
Definitely. Yeah.
It's very, very nice. So speaking on those lines, how can our dental colleagues ensure that their patients are safe in their dental visits? What's your
Well,
opinion on that?
yeah. Okay, thank you for asking that, Dr. Sonia. A while ago, I mentioned that these are the problems that patients and us dentists encounter, because the patients, they're scared to go to go out to. I mean, they will visit you because there's something painful, or there's something there's this discomfort that they feel. But the normal protocol visit is actually not being followed. So what we can do, like, for example, us, we follow rules, we follow the protocol. Of course, the wearing of PPEs, the wearing of face masks, and a while ago I also mentioned the face shield, because actually a lot of countries, and I know in the States that they don't, you guys don't use the shield anymore, but actually it doesn't protect you from, for me, no, this is my take on the face shield. It doesn't protect you from the virus that comes from the outside, but it protects them. It protects the people from your
Right.
exhalation or your expiration of whatever. If you got, let's say, it's asymptomatic and you got the face shield protects everyone from the virus that you might have. So also, we've been practicing the saliva test prior to any appointments. Those are actually not only medically satisfying for the patient, but also psychologically. Oh, this practice has protocols, and the donning and doffing, the washing of hands, and the education part, I think, will play a crucial role in gaining the trust of patients again to come to our practices. I think that's a very important notion that we
Right.
should do.
So you're saying that you actually test every patient when they come
Yes,
in
yes,
through
we
salivary
do.
test?
Yes, we
That's
do here. I mean,
fantastic.
we do because it's really, in the Philippines. It's a lot of it's funny. We make jokes about it, but a lot of people are, when they want to cough, they really keep it in. They're in denial that they feel like coughing, but that coughing is a response to a stimuli. So but because of the notion that coughing is related to COVID, a lot of people here have this, they think it's taboo to cough. So that's why we were really strict with that. I mean, we don't know, it's protecting not only them but also us here, everyone actually,
Yes.
in doing that. So,
And you
well,
use a
it's
full
yes,
full
the
PPEs, your
full
staff,
PPEs, yeah,
full
full
PPEs.
PPEs, full PPEs, and during aerosol treatments, we use the astronaut suit, the
Yes,
PAPR, yeah. So,
right.
so there, so that's what we do. So not only do you protect the community, also you protect also your staff, and I think we play even if it's a small role, but a lot of small things can create a big, a big thing in our war with COVID. So
That's correct.
there.
And how you guys are dealing with the aerosol produced
Yes, yes.
procedures?
Mhm.
I mean, there's a lot of issue being talked
A
about
lot, yes, a lot, a lot.
ultrasound scalers and all that. We know it produce horrendous amount of
Harlan,
aerosols.
exactly.
So have you actually changed some of your ways of doing things, like stopped using ultrasound and
Ultrasonics,
replaced back to either to
manual.
manual or through lasers,
Yes,
whatever?
yes. Well, like for example, surgeries like I mean, there are surgeries which entails the use of piezoelectric machines, which
Piezo.
generates aerosol
Mhm.
also. So sometimes, like what I said, we converted our, well, in our practice, so to speak, our operatories to a negative pressure room. It's like an ICU, or
Right.
a clean room, and then we have a high vac suction that sucks everything. Like it's so strong that sometimes the head cap of the assistant gets, or the gown gets caught in that on that device that sticks in the side of the mouth. So we have that. Also, yeah, the room is, I mentioned, is converted, and there the mask, the PAPR, and the PPE. So like the Swiss cheese model. So I think
Right.
there's a lot of layers that the COVID virus can, won't, if he surpasses one, I think the rest he can't. So that's the whole idea of it, the Swiss
Right.
cheese.
But I think my impression is that the Asians are more compliant to like use of masks and things
Yes, yes,
because it's
yes.
kind of part of the culture already. That you
It's
can
part,
see
yes,
when
yes.
they have a cold or flu. Before COVID, they would wear the mask to protect other people. So that's more of a community
Yes, a community effort.
mentality. When you
Mm-hmm.
come down to some Western society that say, look, my right gets a bit more complicated because they
Yes, yes,
want their
yes.
right, but they don't think about the other people they may be infecting, or
Exactly.
let's say by not having a vaccine, they are allowing this virus to travel
Reach.
and
Oh,
mutate amongst the. So it's a bit more complicated because we can see
yes.
different continents and like even in Europe, they're a bit more
Oh, yeah.
socially conscious that the
Mm.
government can actually enforce much more the use of
I,
masks,
you're
and people
correct.
are
Mm.
not so doesn't challenge as much. But here in the US, you have a big problem with that. Um, but yes, I been accompanying this, and I think there are some countries in Asia that managed to control COVID pretty fast, right at the beginning, because of the wide use of masks and.
Actually, India, for in my point of view, India did. I mean, comparing their status before, when the surge, came to India, but now they're actually better than the Philippines now. No, I mean, because well, one of the reasons also is their pharmaceutical industries there are really
Oh
vast,
yeah,
and
this is strong.
yeah.
Mm.
But like what I said, like what I was telling a while ago, what's the I mean, of course we charge for the saliva tests, and what's that amount compared to being infected and paying huge amounts when you get COVID? That's what we tell our patients.
Right.
This is just a fraction of just to be. It's better safe than sorry. And yeah, the use of face shields. That's why I think it should start from yourself. The change. So you're like what I said. You're not protecting yourself. You're protecting the people around you in wearing those
The
protective
shield.
face. Yeah, yeah, face shield. So there.
Right. So going to another question.
Okay.
What, in your view, what's the main role of the healthcare community in preventing COVID?
Okay. Well, the oral healthcare community actually should be united in co-management should happen. I mean, I'm very certain because like what we experienced in my uncle who passed away, all the doctors are busy treating COVID, the virus. All the doctors are, or the scientists are busy researching what can kill, what can stop this. But us, the oral health providers being here, we if they only involve us, no, I'm definitely sure we are involving ourselves, and we play a major role in fighting this COVID. But if there should be a commission or a group that would really give importance to the oral factor in it, I think the prophylactic measures that we can provide will surely greatly decrease the number, and even stop this pandemic that we are in right now. So that's how important I think the oral health providers plays in this war against COVID. So co-management and us also. So there.
Yeah, so that was, it mentioned co-management. That was my last question to you.
Okay.
Is co-management with medical doctors important in your opinion, and how can that take
Definitely.
place? How can that be coordinated?
Definitely, like intubation, it happens like what I said. Not only do you get the bacteria from the intubation tubes, okay, but also you get it from periodontally compromised teeth. So I think prior to the patient being maybe we can set a protocol on patients who has really poor oral hygiene, that prior to treatment or in conjunction with the COVID treatment, a rigorous treatment of the mouth should be done also in conjunction with, those are just ideas that comes out of my head. But I think with those little, remember, the big sequoia tree, even lightning cannot destroy the tree. Only the small termites can destroy that big tree. So what I'm trying to say is the small things are the ones that we often miss, but these are the important things. So there.
Yes,
So
there has been quite a few clinical trials in Brazil on the importance of the oral and dental treatment and periodontal treatment in those cases with COVID. And it's been they have shown that it is a dramatic reduction in severity when those patients are accompanied by a dentist during the treatment process. And in Brazil, is normal now that hospitals they have a dentist to treat patients. That's established protocol now, the protocol. And especially any patient that goes to UTs for anything, it's before COVID, they're always taken care of in parallel by a dentist, because they had already figured this out, that the mouth, by preventing and doing the oral hygiene in those patients, they could reduce the severity of pneumonia and all those.
Yes.
So this has already been a protocol for quite a few years in Brazil. And they did this research and they showed the reduction of death when they intervened by a dentist, reduced death in COVID patients. So I'm very proud of being
Brazil's
Brazilian
doing
in that respect. There are a few things, like you said, some things that people don't think about, and you think, oh my God, So yes, of course, it's not like we say, but they had a lot of people dying in such and such place in Brazil. It's so huge, and not everybody go to a hospital unit. Sometimes they go to the local community healthcare service to be taken care of. So, but where those dentists are, they have been seeing really a very good reduction, which is
results. Amazing. So how many is the population there? And I think Brazil is a big country.
yes, this
is like the small United.
It's about the size of America, but it's actually, if you look at the geographically, if you remove Alaska from the American map, Brazil is larger. It's actually larger than America. So I would say, we are very similar. So 200, we're about 200 million now, I think.
Oh, good. Wow. So how many dentists, the ratio? I mean, is it?
Oh my God! You don't even ask that.
Okay.
It's the largest in the world.
Okay.
We could export them a lot. Okay. Yes, it's the largest capital of dentists in the world per large number of dentists per capita. Yeah, it's big.
Okay. Amazing.
Yes. What else I was going to say that anything else that you'd like to comment?
Okay, so I'd like to just say to everyone, stay safe and please get vaccinated. This is the only way. I mean, this is the only concrete and evidence-based way that we can end this. All of us are tired. Don't try to drown the stress alone. You have family, you have friends, so it's very depressing. But get vaccinated. Thank you again, Dr. Sonia, for hosting the lecture. How do you say it in Brazil? Obrigado.
Obrigado. Very good.
Obrigado. So, obrigado. Thank you. So, with that, yeah, that's it. That's it. I hope we could I could visit Brazil soon, or just we could meet, and all of us, it will be back to normal again. But
Well, the Global Summit Institute soon will have our
yes,
big meeting, the
mhm,
gala meeting,
the gala, yeah,
which
the
I'm
gala.
sure that everybody's invited. And
Yes, yes.
with COVID now, everything was kind of postponed.
Moved,
And
yeah, rescheduled, yeah. I know.
and
So
like a lot of the live courses gone online, but I think people are desperate to just go out and see each other in person because
exactly.
it gets
Oh,
quite stressful. And I
even
think,
going to the yeah, even going to the grocery is a luxury now. I mean, it's like going to Disneyland, going to the because you really don't get to
yes,
go out. So
it's
there.
interesting you saying that. Like I used to hate to go to the supermarket, but now it's like, oh, isn't this nice?
Yes, it's nice you get to go out. Oh my good Lord.
Yes, I really appreciate now every outing I have now. But like Texas, where I am, is one of the states that we still having quite a bit of problem because it's related to the states that we have less vaccinated people, that we actually started getting an increase again in
Yes, yes,
cases
yes. Mhm.
and an increase in hospital
Oh yeah, yeah. Finally.
occupation,
Mhm.
which is very sad.
Yes.
So there are some places thinking about going back to mask mandates and all that.
Mhm.
So let's see. Let's hope we get more and more people get vaccinated
Yes,
so
yes.
we can
I pray for that.
all be
Yeah.
free together,
I
not
know, I
just
know. Oh, good Lord. But yeah.
because yeah, I had also many friends here that were fully vaccinated and got COVID because we're allowing this. Um, okay,
Oh yeah.
yes, so I would love to be talking to you all day, but yes, thank you very much. I think
We have to end this.
the
Yeah.
time is up and we got
Yes.
to be
So
carried
to
away.
everyone, yes, stay tuned to the next lecture. It's also as interesting as this one.
Yes,
So yeah,
and
there. Thank you,
and I
everyone.
encourage everybody also to look at the library of the Global Summit Institute, because we have amazing videos and amazing collection of lectures. And please register for the CE down on the chain. Thank you all
Thank
and
you.
have a
Thank you.
wonderful end of Sunday. And I believe
Yep.
we have another wonderful
Yes.
Podinar following us now.
Okay.
Thank you again.
Bye. Bye.
Stay
Goodbye.
tuned.
All right.
Bye. Thank you,
Bye.
Doctor.
Bye. Bye.